everyone, welcome. And if you are pregnant or you've been pregnant or you love someone who's pregnant or you're hoping to become pregnant, you have come to the right place. We are here to answer all of your questions about how to empower your pregnancy and your birth, as well as your postpartum journey, and to get an early start celebrating Bump Day, which is coming up next week. And I can't imagine anyone I'd rather have this conversation with. Dr. Wanda Barfield is the CDC's Director of the Division of Reproductive Health, and she is a longtime champion of efforts to provide all moms, babies, and families the best and most equitable healthcare possible. So happy to have you here, Dr. Barfield.
Oh, Heidi, thank you so much for having me.
Oh, and this is such an important conversation, but let's start with the power of being empowered in your care. Knowledge is power. I always say that. It's especially empowering when you're pregnant or you're a new mom or you're giving birth. And there are always so many unknowns and so many questions that you'll have. But one thing you should never have to second guess or be wondering about in the back of your mind is, do I have the right provider? That's something you should feel confident about throughout your pregnancy and right from the start. What are some ways, Dr. Barfield, that moms can find a healthcare provider that they feel not only comfortable with, but confident in?
Yes, so, finding a healthcare provider is so critically important because it's a really important relationship during a really critical time. And it's important to find a healthcare provider that you feel comfortable with, one who really listens to you and addresses your questions and concerns to your satisfaction. And as you've mentioned, Heidi, pregnancy and the postpartum period for many is really a new experience. And so having someone who can be helpful and guide through that period, but also understand that everyone's an individual and may have very unique experiences is really important. So some people get recommendations from friends, from family, from coworkers, and others may look at reviews online. We all have different ways in which we want to gather information that are so important to us. But the important thing is that in identifying that healthcare provider, that you feel valued and that you feel respected with the healthcare team. And it's important to think about ways to identify that relationship early so that you can then really get a good sense of that type of provider and what you want. Now, not everyone has the option or the opportunity to really think about their healthcare provider, but we just want to encourage people to find someone that they think that they can build trust with.
Absolutely. And how important, because it is a team effort, you are partners with your provider in your healthcare. I think it's important to stress that healthcare isn't something that happens to you, but should happen with you. So it should be, you should all be on the same page and united and comfortable together. How important do you think it is for Black moms to choose Black providers if they can? Keeping in mind that every provider is different and that every mom's needs are different.
Right. It's important for people to identify the healthcare provider that they feel most comfortable with. And for some Black women or women from other backgrounds, they may be very comfortable having a healthcare provider that looks like them, that may have similar experiences, that may live in similar areas. And again, that's part of just fostering a relationship and a relationship of trust. And every mom deserves, no matter what background they pick as a provider, they need to have equitable and respectful care. And when moms are sharing their questions and concerns, it's really important that that healthcare provider takes them seriously.
Absolutely. And I think this brings us really well to the next topic, which is your pregnancy bill of rights. I think it's really important for pregnant women to know what their rights are, and even that they have rights. And in fact, we just published a piece on what to expect that you can in the chat, that will go over all of those rights. Very important stuff. And I'm just going to run through them quickly, and feel free to chime in if you have any feedback. The first, and you were talking about asking questions, so important because you have so many questions. The first right is to ask as many questions as you want. And it's not like you have a question quota, especially new moms, but even second time, third time, fourth time moms, you have questions, you deserve answers, and answers that you understand. And if you don't understand them at first, that you get the chance to ask follow-up questions, right?
Exactly.
And
And
then
sometimes it's also
yeah.
helpful to even write down those questions that you may have. That may be very helpful.
Yeah, because there's one thing about pregnancy that we all have noticed if we've been pregnant, is that you get a little bit of placenta brain, pregnancy brain, mom brain. And so, your body's working overtime in other ways, and forgetfulness may be one of the symptoms. So write down every question and write down the answers. Make sure you have those answers. To have culturally competent and appropriate care is something we already discussed, really important. To be respected, also something you touched on. And I would add responded to, because just being called ma'am or something, or, that's not respect. You need the response that comes with respect to make you feel that, as you said, you are valued, not to be dismissed. And also to feel all of your emotions, whatever you feel, without guilt. And, without necessarily some kind of arbitrary filter, because there should be no shame in the mom game, wouldn't you say?
Yes, there should be no shame.
Yeah,
that's really
no
important.
judgment about how you feel. It's also your right to challenge and report mistreatment. Do you want to speak to that a little bit?
I think there's an opportunity for people to identify circumstance where they feel like they've been mistreated. And even within facilities, I mean, this is the opportunity to either raise the concerns to maybe a nurse manager within a clinical practice, or in a hospital or facility, in terms of patient care, and making sure that you're receiving the care that you deserve. And often facilities may even have information about patient rights. And so talking with hospital or facility administrators, I think, is really important if there are specific concerns.
And to do that homework ahead of time, if you do have a choice of a hospital, or just so you know what your rights are in that facility. And then you also have the right to think through your options before deciding. There are a lot of things that happen often, especially during labor and delivery, very quickly. And even during your pregnancy, there may be lots of options. And I would say you need to be able to have those options presented to you, and to know whether they are medically feasible, which ones are in the best interest of you or your baby, which are not, and then think those through if there is time to do so.
Yes, sometimes there are circumstances that are urgent and emergent, yes. and it may be, unfortunately, in those circumstances that communication is not as ideal as it should be. But I think acknowledging that things may be urgent and important, but that you still need to know information, is very important. And it may be that it isn't the direct provider per se, but a member of the healthcare team that can inform you as things may be going, urgently.
Exactly. I feel like that's one of the reasons why having a doula by your side, especially during labor and delivery, and possibly during your postpartum time as well, is important, because then you have someone who's able to find out what's going on and let you know what's going on, because you're in a very vulnerable place when you're birthing, and things are happening around you. Maybe it's stressing you out. And that's why it's good to have an advocate by your side. But I would definitely stress that there is no substitute for a provider that you feel comfortable with. And that means someone who's delivering your baby, giving you prenatal care, which a doula does not do. She is a support person, and she or he is a support person. But to find that doctor or midwife, and in a low risk pregnancy, midwife might be a better choice, if a certified nurse midwife, if you are looking for a certain kind of care and a certain kind of birth. And again, have informed consent. So if something's happening that you are told about it, you sign off on it. Again, assuming it's not such an emergency and things are happening too quickly. And also to change your mind at any time. If, for instance, you've decided you want an epidural and then you decide you don't, or the other way around, to be able to change your mind if it's appropriate, medically appropriate. Always, that's the bottom line. You want a safe pregnancy, a healthy baby, a healthy mom. That is a happy ending.
Yes. So I think that, the other thing to take into consideration is that your healthcare provider may be part of a larger team, because it is challenging to know exactly when babies decide to arrive.
Right,
And
I noticed that.
yeah, and it's important to think about your provider as part of a team, and ideally getting to know the other members of that team should the circumstance arise that your primary provider is not available at a particular time that you need them. And so just thinking about that team perspective is really important. And that's also where, doulas can play a role in terms of helping to identify the members of the team and helping to support and fostering the relationship, as well as, a close family member, your birthing partner, or the person that you really want to be with you during your birthing process.
Absolutely. And it should only be people that you want with you at that moment. Yes. In case your mother-in-law asks and you're like, nay, that's totally fine. So yeah, I think the team approach is great. There's something wonderful about having a solo practice, because that's the one person you've chosen and the one person you've gotten to know and feel comfortable with, but they can't work 24/7, 365. So that's why, if you have a group practice, which many providers have, and if you have a midwife, certified nurse midwife, who works with an OB or an OB practice, that can give you the best of both worlds, because if you do end up having complications, or you become a high risk all of a sudden, or you need a C-section, you are also comfortable with the OB that she's working with. So I think that's important. I always tell moms, I'm sure you agree with this, you know your body best because you have lived in your body your entire life. And that's a long time, even for a young patient. But I think, although as a pregnant patient, because you know your body so well, you are uniquely positioned to advocate for yourself. In reality, a lot of moms are hesitant to do that, especially first-time moms. And, and when they do, sometimes providers don't take them seriously. Something else important that you touched on, which means you need a new provider. And it's also, unfortunately, true a lot of Black and brown moms when they speak up. And what are some ways that moms can advocate for themselves during pregnancy?
So I think that getting to know your provider is important, so that you can establish a relationship, especially during a time where maybe there isn't a concern or things are going very well. And the other thing too is, I think that it is important to have other sources of support in addition to a support person like a doula. But if there are important family members or again, birthing partners or friends that you think are important in your life, that is important as well. And
Yeah.
for Black and brown women, again, it may be that they do have other support networks, but I think making it clear that these are people who are important to you, I think is also very important as well.
And also, I think knowing when those people in your life who you feel close to and important to, they're not necessarily, so you need the balance of the experience, the lived experience, as well as the medical experience, so that you get both perspectives and not sort of, mom says this, provider says this, and how do you balance that? So it's important to validate your mom, but it's also important to know when it comes to a medical decision that you need to be able to trust your provider, which is why we need those providers that we feel confident in, right?
But, I think the real challenge is that for some moms, particularly for Black and brown moms, there are issues of power dynamics that play and make it very difficult to communicate concerns. And I think, as a provider myself, I have to understand and realize that people need to feel trust that I'm trustworthy, that I can be trusted, that I'm listening, that I'm trying my best to understand what their concerns are, and it's important to take the time to do that. And again, even within medical environments, there's a different language, there's a different vocabulary. The way things are said may not be completely familiar for those who haven't had that kind of experience. And so we really need to acknowledge that. And I really do think that although it's important for moms to advocate, it's also very important for providers to provide opportunities to listen, right? And for birthing people to be heard. That's really very important.
It's incredibly important, and to have others advocating for you, but also to feel the comfort level that you can speak up. I find a lot with, I work a lot with military moms, and often military moms feel, oh, every mom feels like she has to be strong and, pull herself up by her, bootstraps, even though her feet are swollen, just be as tough as possible. And I feel that military moms often feel that they have to be extra, 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 extra strong. And they should just, whatever is happening to them, they just have to tough it out. And that's, not necessarily the best thing to do when you're pregnant or you're a new mom, you're recovering from labor and delivery. You need to speak up when something is bothering you, and you need to advocate for yourself. And if you don't, if you've had the experience that you don't challenge authority ever, and you don't ever have to challenge in a way that's, negative, but to have a conversation, if you feel it's not your place as a patient to speak up, then that's something you have to work on, right?
Yes, I mean, I love military moms and military families. I worked in the Army as a neonatologist for many years, and yes, they are so amazing. I think that really thinking about creating environments that are supportive, and again, a lot of it isn't necessarily even the direct health provider. This also involves, the people who are checking you in the reception desk, those who are helping to keep the environment very clean and sanitary, those that are providing food and food service in other areas. How can we collectively think about ways to support moms through their pregnancy, delivery, and postpartum care? And we're thinking about that in terms of how we not only amplify the voices of women, but how do we also educate and inform those who are involved how they can be helpful.
Exactly. And especially for providers who this may not be their, experience. Their experience is totally different. And so they're, whether they're freshly trained or they've been in practice for 30 years, it's just not their mindset to do the listening, but rather to do the talking. And we do have to work on that. Actually got some live questions in that I wanted to touch on that are relevant. I've never hired a doula before. How do I evaluate who would be more helpful during my delivery? What should I look for?
Oh, that's a
in a
good
doula?
question. I think some of it is also having an opportunity to have a conversation in terms of thinking about whether this person would be a great birthing partner in terms of their support. And some of it's
Yeah,
going to depend on what your personal style is.
exactly. And so that's why it's important, if you can't, have consultations with any provider who you're considering, and that goes also for doulas. And someone else asked, is a doula or midwife beneficial or able to help even if you have a high risk pregnancy? And I would say doulas, absolutely. And, what are your thoughts about, you need if you have a high risk pregnancy, you may be shifting from either a nurse midwife to or an OB to a specialized OB who specializes in maternal fetal medicine. Is there still a place for a doula?
I think that there is in terms of communication. It's also important to note that, there are doulas that play a variety of roles,
Yes,
certainly prenatally and certainly through the delivery, but the postpartum period is also a very important time when support is needed. And it may be that those are the areas where perhaps a doula may play an important role there as well.
absolutely. And we're going to talk more about postpartum because that is a journey in and of itself. But first, most pregnancy signs and symptoms are completely normal. Let's start with that. And you could have every pregnancy symptom in the book, literally, or you could just have a few, or you might sail through pregnancy without any at all. It could be mood swings, heartburn, feeling tired, feeling even like it's harder to breathe because you're breathing for two, right? And your belly is jutting out. But sometimes I think that what is often dismissed as part of the pregnancy package might be a sign of something more serious. And I know you feel this way, and how certain pregnancy symptoms might actually overlap or mimic symptoms that are more serious, symptoms of complications. Let's say you have a headache, but it's not just one of those hormonal headaches or low blood sugar headaches. It's a blinding headache and it won't go away. Or you've noticed your baby isn't kicking as much as usual. Like I always say, when in doubt, get it checked out. What are some of the most urgent maternal warning signs during pregnancy that you want moms to know about and their partners to know about? So if they notice them, that they can speak up as well. And how do you know what can wait, what needs checking out right away, what you even need to head to the ER for?
Yes. So I think, first of all, as you've alluded to, it's important to note that no matter what the sign is, if you feel like something is wrong, it's important to talk to a provider about it right away. But there are some specific warning signs that we consider urgent for pregnant and postpartum women. So if you experience one of these, it's important to go to the doctor right away. And if they can't see you, go to an emergency room. And so these include, as you said, a severe headache that just won't go away, dizziness or fainting, changes in your vision, or a fever over 100.4 degrees. And also others might include trouble breathing or chest pain or overwhelming tiredness. And also other signs are extreme swelling in your hands, your face, your leg or arm, these could lead to a serious complication. So you
Yeah.
might also there are also some other warning signs that are important. For example, if you're having thoughts of harming yourself or your baby, it's important to talk to someone because there is help available. And also, paying attention to your baby's movements. I mean, they may vary, but if they stop or slow down during pregnancy, it could indicate fetal distress. And there's also more information on our website, www.cdc/hearher, that has information about these maternal warning signs in the CDC Hear Her campaign. And I think someone will probably put it in the chat to make sure it's most accurate.
Absolutely. Absolutely.
Yes.
And I feel like you should post them somewhere in your home and make sure that your partner is aware of them as well as other family members. It takes a village to raise a child, but first we got to deliver a healthy baby to a healthy mom. That takes all of us. And so the more people who know about these signs, and that's why the campaign is so incredibly important. And to remember that the value of mom gut, and I'm not talking about the heartburn and, the other tummy troubles. I'm talking about your mom gut, which is something you need to get to know and get to rely on more. I'm a huge believer in mom gut. So what do you do if a provider dismisses a symptom that you are finding troubling, concerning? You can't put your finger on it, but you just know this is not how you're supposed to feel, which is often the case. It's very vague, but you just feel something in your mom gut. And by the way, mom gut is even more essential. You're a neonatologist, you're a pediatrician by training, how important it is when a parent notices a symptom in a child that, they trust their mom gut. But what do you do if your provider just writes it off?
Right. So it may be that the provider either didn't hear at that particular time. So it may be important to try to reach out again or follow up with the healthcare provider team, because it's just possible that for whatever reason it didn't resonate. But I think if, after trying to reach out and not getting a response, it's important to seek other support. And if that is, an emergency room or some other means of health care, that may be an important thing to do as well. And again, talking with others to see if you can get the support that you need from your provider.
And if, for instance, you call, this is why I think it's important to get to know the office or the clinic that you're in, because if they have a system where, the person at the desk takes down all the questions, may not understand the urgency of a symptom, or may, think it's not a big deal. How they're triaged, how those concerns are filtered through and get to the provider or don't. So if you get that response from someone at the front desk and you don't get a call back, to make sure that you do and that you insist, or that your partner insists on someone hearing you. Because we have too many stories of moms who were not heard, partners who were not heard, and we want to stay away from that situation.
Yes.
Because it could be something completely normal, right? It could be just, pregnancy as usual. Pregnancy can suck, but it could be something more serious.
Right. And there may be ways to objectively reassure that would be helpful to know. So I think making sure that there's an opportunity to speak with a provider and at least understand if the concerns appear to be normal, getting an explanation of what that actually is, I think would be very helpful.
Absolutely. So what about delivery? That old thing. It's a walk in the park, right? How can moms plan at least the best that they can for an empowered delivery? What are some steps that they can take in the months leading up to D-Day? I've already mentioned finding a doula. We've already talked about finding a provider who you feel super comfortable with. And by the way, I think we also mentioned that if you are not feeling confident in your provider, that you change. I just had a mom message me just based on the promotion for this mom hall. She said, you've given me the courage to change my provider. I feel she's 30 weeks along. It's not ideal to change at 30 weeks, but it's better than being with the wrong provider as you near in on delivery. So I think that's an important message. Do you have anything to say about when you should change providers?
So I think that it sounds like you spoke with someone who really felt empowered to make that change.
Yeah.
It's important to make sure that that information gets transferred over to the new provider. That's really important in terms of keeping information. But in terms of thinking about, a birthing plan, I mean, the best made plans may not necessarily work out the way that we want to, because one, time is not predictable and some of the circumstances are not. But it's important to feel at least empowered during that process, even though it may not be the exact plan that's desired. And I think, having some flexibility in that we're all hoping for the best outcome, right? For a healthy mom and a healthy baby in the end. And so I think really thinking about how that plan can be conveyed in partnership with the healthcare team is really important. And having try your best to express the plan early on, so that it's clear what your plan is, and hopefully you'll be able to see your plan through.
Absolutely. I feel like it's important to see it as a wish list, right? And these are things that I've looked into that I would like to try if they are possible in that moment, within the realities of my pregnancy, my labor and delivery, how the baby progresses or doesn't progress, even what the hospital will allow. You may want those, aromatherapy things, but maybe your hospital doesn't allow it, diffusers. But what you can do ahead of time is think about what is on your wish list, show it to your provider. If you can show it to the hospital as well, if you do a tour, anything like that, just so that you have reasonable expectations going in. And then, as you said, you can't, you can write down, pencil it in, but don't engrave it in, purple Sharpie, because it isn't necessarily going to go that way. And then I feel also that it's important to feel good about this happy ending, this healthy mother and this healthy baby, even if you were so hoping to avoid a C-section and it becomes medically necessary, especially if you have a good provider and a good support system, that is a really positive outcome, right?
Yes.
So that's really important. But again, check out all of these things because they may sound good on paper, and then you may decide you want, an unmedicated birth, and then you're like, give me the juice, right? And that's up to you to decide, and that should always be your choice. And nobody should bully you, or demean you or make you feel badly about your choices. Unfortunately, there's a lot of mom shaming about what happens in the birthing room, and I feel like safety first, everything else, as long as you have a healthy baby and a healthy mom. What if your provider is insisting on scheduling a C-section, or a mom just asked about having an episiotomy, because this is something I have no idea, because providers don't usually routinely perform episiotomies anymore. So I'm not sure if this is a relic of birthing practices. There are some times when episiotomies are necessary, and there are definitely times when cesarean sections are necessary, but sometimes they're done just because, that's what the provider wanted to do without being as necessary as that. Or inducing labor or something like that. You want a VBAC, that your provider is saying no. And maybe not explaining why to your satisfaction, or putting an arbitrary time limit on pushing, or what position you can push in, and any number of scenarios. So what's your best advice for a mom who's feeling like, this is not my birth that I wanted. What can I do about it to advocate?
So I think that it's kind of complicated to answer that question in the context of what some of, individual clinical scenarios may be. And I think at the very least, it's important to have a conversation with your provider about what things might need to change or may appear to veer away from the plan, so that you understand why.
Yeah, and I think that's really important, because you may have your heart set on a certain type of delivery, but it becomes unsafe. Maybe, the idea of VBAC because of the position of the placenta, any number of reasons, it's just not in your baby's best interest and in your best interest, or something's happening with your baby's heart rate. And, they need to get that baby out of you in a safe way. But I think the important part is, because every situation is different, as you said, and, it has to be determined case by case, that you get the answers that you need. So your provider says this is happening, and you just ask, okay, why? Are there other options? And that provider should treat you with respect and empathy, and understand that you wanted this, you had your heart set on it, and it's disappointing, but then point out why it's important.
Yes.
So then you have your baby, right? It's postpartum time. A lot of moms, I think, expect smooth sailing. At least after this 6 weeks recovery, that everybody talks about. But let's do a reality check. How long does postpartum recovery really take? And when and how often should a mom be seeing her provider, even just for routine care, but especially also if something doesn't seem right?
Yes. So, modern medicine has been amazing. And even in the context of surgery, you may have a small incision, but there was a lot that went on below the surface. And so it's really important for people to get the care after delivery. And the American College of Obstetricians, Gynecologists, also known as ACOG, recommends that all women have contact with their provider within 3 weeks following a birth, and get ongoing medical care as needed, and have a complete postpartum checkup no later than 12 weeks after giving birth. It's important to note that, some women may have other medical conditions that also need to be addressed and should continue to be addressed. So making sure that there are opportunities to follow up in those areas are important too.
And again, if you have a symptom that you're not sure is normal, but you're thinking maybe this isn't quite right, that you don't have to wait for the 3 weeks or the 6 weeks, or the 12 weeks, that your provider will see you, and not only see you, but hear you, of course, and also, not dismiss what's going on in your body. And also, like you said, this is, pregnancy, labor, and delivery, this all takes a toll on your body. And so you shouldn't have realistic expectations of what recovery will be like. And you should be, taking your time in that recovery. And I think that's why, because complications can happen later on, they don't all happen just after childbirth. They don't always happen in the hospital. Often they happen when a mom gets home, and they can happen within an entire year postpartum, which is why that continued care, a continuum of care, is so vital, right?
Yes. And some communities do offer home nurse visiting programs. So it's important to identify resources that can help in that postpartum period. Just even having the support. I mean, a new baby or babies can be very tiring and exhausting. And so having that support and thinking about ways that, within your home and your community, there's ways to get support, because it really is important. But, yes, it's really important.
And for certain, it's where the village comes back in. But I think if you have the option, and in the military, they have this, of new parent support.
Yes.
But there are other programs like that, as you said, in certain communities. That's invaluable, because let's face it, getting up, getting dressed, getting, out of your pajamas postpartum, that's really hard work. And so to get to the doctor isn't always necessarily the easy thing. It can be pretty challenging. And that's why home visits are so incredibly important. I wish every parent could take advantage of those. And it's also a good time for education, about in a less stressful environment, like, this is safe sleep. When a baby's crying and you're trying to get your postpartum care, it's a lot harder. So, but I do want to run through some of the serious maternal health complications that can happen after delivery. You expect fatigue. How much fatigue should you expect? You might have, some lingering swelling. It doesn't disappear right after you give birth, especially if you've had IV fluids. And you can have pain just because you had this baby come out of you and it hurts. But when is it, an urgent maternal warning sign?
Yes, Heidi, you bring up some important points about thinking about warning signs in the postpartum period. And these could include things like heavy bleeding, fever, severe belly pain, and severe headaches. And it's important to notice how you are progressing in the postpartum period. Are you feeling, for example, extremely sad? Are you having thoughts of harming yourself or others? And, these are signs where you really need to get help immediately.
Absolutely. And I think Harry is asking for help. Harry? He's 20 years old, so he barks at like random things. But yes, absolutely, to be alert to those symptoms and to report them. I would say that not all of these symptoms, this is actually a really important point that you made before Harry started barking, is that not all symptoms that are urgent are physical symptoms. A lot of them are, but not all of them. And we have to be so mindful of symptoms of PMADs, perinatal mood and anxiety disorders. So while, baby blues, that's, that lasts a couple of weeks, you're a little weepy, emotional, you're certainly overwhelmed. But if those feelings continue and get progressively worse, or you have severe anxiety, or you have thoughts of harming your baby or yourself, or, you just can't function, and there are many other symptoms, then you need to get that help. And if it is a life-threatening situation where you're afraid you're going to do harm, then to call 988, which is a great resource through SAMHSA. or
Yeah.
text 988, and
Yes.
make sure your baby is safe while you do that. So those are really important. Now, I can't close this without saying how much I love the Hear Her campaign. You've heard me say that over and over again, because, and everybody who hasn't heard of Hear Her, just follow hashtag Hear Her, and you will, and go to cdc.gov and / anyway, they're putting it in the notes in the chat to find out what those urgent warning signs, but also to see stories from moms who have had experiences where they weren't heard, or maybe they were heard finally, and so everything that could have gone wrong didn't in the end. And so I urge everybody to look at the Hear Her campaign. But in the meantime, can you tell me what the inspiration for this amazing campaign was?
Oh, wow. Really, one, understanding the data and the impact that we were seeing, particularly for Black, American Indian, Alaska Native women, and knowing that there were these huge disparities, but
Yeah.
also understanding, and hearing about stories of women that weren't being heard. And unfortunately, at CDC, it hit home when
Yeah.
Lieutenant Commander Shalon Irving, who was a public health service officer, an EIS officer, an amazing young woman, and mentee, died of a pregnancy-related complication, and had tried so many times to talk with their provider that something wasn't right. And we knew, and it just at that time seemed like these stories were just sort of flooding, the national news, and many people were experiencing similar things. And so we knew that we needed to think about some way that we could increase awareness,
Yeah.
of this critically important issue. And what can we do? What can we all do collectively to, support birthing people and pregnant and postpartum people?
Mhm.
So it's been really an amazing journey with many of the staff at CDC and our communications team and the division in particular, but as well as these amazing women. So the first group were women from Georgia, and it was just really an honor to meet them and work with them. And the most recent work that's occurring now with American Indian and Alaska Native women, and just having the honor that they're actually sharing their stories and experiences so that other moms may benefit and that other families may benefit.
I think that's so. I can't stop looking at those videos. They're so they tug at your heart, but they also are call to action. An action for all of us that we have to pay better attention. And see this as because let's face it, 80% of maternal deaths are preventable. So most of these are preventable. And if we can prevent one, then we should prevent every single one that we can, because it's heartbreaking enough, but it's vastly more heartbreaking. And, to see someone with their own medical expertise being ignored, and quite possibly because she was Black, that's not acceptable. It's not acceptable in the wealthiest country in the world. So we know what works. And one thing I want to say is that a public health campaign that's personal, that's as good as it gets. Public health is personal, right? And it impacts everybody in this country, and in the world, but it should be personal. And that's what you accomplish with that campaign. So
yes, and thank you. And there's lots of tools and resources on the website that we encourage anyone to use. There are palm cards, there are warning signs, in the form of, emojis or symbols. We
Yeah.
have them in, I think it's now 17 different languages. So I'm just really trying to reach, everyone and give them the tools to be able to help in terms of preventing these preventable deaths.
That's so great. And I want to talk about someone else who can play a role in an empowered pregnancy and birth, and a safe one. Dads. When there is a father in the picture, the research shows that when they are included in care, intentionally engaged by providers and invited into the process, they end up being the very best maternal health champions that there are. And often they're the ones who report symptoms, because mom isn't in any condition to report that. It could be another birthing, non-birthing parent, but I think it's time for us to start acknowledging the importance of dads in perinatal care, and to do that engagement of them. I think Black and brown dads especially, I've had so many conversations with dads who say, I was treated as the baby daddy. I wasn't even invited to the table. That's not okay. They are not the problem, they are the solution. And so I think, if you're a dad, I hope there are dads watching today, but in terms of your partner's health, your baby's health, that you are incredibly important in this process. So do you have anything to say about dads and other partners?
Dads are critically important, not only for the health of the mom and the baby, but also for their own health. We know from studies that paternal health improves as dads are engaged. They reduce riskier behaviors, they do a better job of taking care of themselves. So it is of mutual benefit to everyone for dads to be involved in care with mom and baby. And again, that's another opportunity that healthcare providers have to really, invite dads at the table and give them additional responsibility as a member of this whole team to help and support moms, particularly during the postpartum period. There are great opportunities to, as you mentioned, identify warning signs, assist in other ways, support in the care of a new baby, and just provide that additional support that everyone needs.
Absolutely. And that's why we need paternal leave in this country, but we also need maternal leave. So we just need paid family leave, period. But so when to see the campaign Hear Him?
We are continuing to work on a lot of areas in the Hear Her campaign, and that's currently our focus right now. But we do advocate that dads are aware of the Hear Her campaign and can continue to participate and support in these efforts.
That's so awesome. I have a couple more questions, but I think we've covered most of them in this incredible conversation, which I cannot thank you enough for. Everybody check out Hear Her, and everybody else. I want to remind everyone, including you, Dr. Barfield, not that I have to remind you, but next week, Wednesday, July 19th is our 9th annual Bump Day, and it's a day of advocacy and action. And it's a day to celebrate beautiful bumps, but also to tell the stories of families who've been impacted by the maternal health crisis, which is something you've been doing and we've been doing. But, this year we're taking it a little bit farther with the action. It's definitely about the celebration, but also about calling for the action that we need. So you can share a bump, past or present. I dust off my 3 Polaroids that I have, the only evidence of me ever being pregnant. It could be your bump, someone you love. And Polaroids, yeah. And very fuzzy. And then use the hashtag bump day. Also follow Hear Her, and let's deliver a healthy future for every mom and every baby out there and every family.
Oh, thank you so much, Heidi. Thank you again for the opportunity just to have this conversation with you about the very important issues.
Thank you so much. And lots of hugs. Big hugs to everybody. Bump day hugs in advance. And we'll see you on bump day. Bye.